Is Sadiq Gopal. I think United States economic policies are also contributing to this kind of killing. I will tell you why. Because the globalization agenda, right? The globalization agenda, a massive privatization has been forced in the third world countries like India. Like for example, in South India specifically, there is a massive privatization of healthcare which has destroyed. For example, the ultrasonic and sonogram machines have been rapidly came up, which are contributing to this millions of killing. So I think it is very important to analyze, right, how the globalization and United States economic policies, right, what is the role in this massive killing? Because the privatization is also one of the factors destroying of the health conditions in India. I think you have also mentioned the forced abortions, illegal abortions conducted by these private clinics, and this illegal determination tests conducted by this massive privatization is also one of the reasons. You please respond, ma'am.
Yeah, I'm sorry, I can't. You were saying the privatization of healthcare in India. India is not my specialty. I'm sorry, China is, and healthcare is not privatized there. So I'm not really able to respond. Is anybody else able to respond to that question?
I just would like for you to expand because I don't understand. I don't believe that you made a connection. How do you? Why do you say that the privatization of healthcare? Why do you say that?
Okay, IMF and World Bank are compelling the third world countries to privatize healthcare and education. For example, I'll give you an example. In South India, a state called Andhra Pradesh, right? Millions of public funds are being diverted from public health to private healthcare, right? There are some schemes, right, where they have literally destroyed the public healthcare, public hospitals, and diverted these funds, right, very skillfully to the private hospitals. What private hospitals are doing is they're performing operations, illegal abortions, just with the intent of profitability, right? It is not on health, it is not on medical condition, right?
So you're saying that the public clinics did not do that? That this
Yeah,
is done by private?
Because there is no regulation, there is no controls and checks and balances. The medical field is a welfare sector, right? Where the doctor needs to make the determination that the patient needs an abortion or not, whether the sonogram test is required or not. But if there is a section of private doctors, right, who are engaging rapidly with the intent of profitability. So I think it's also one of the compelling reason, right, the rapid privatization of healthcare will also is contributing this kind of situation.
Well, let me just conclude with what Reggie said, and that we don't have the expert on India up here. On here.
I'm not going to respond. Now I understand what you're saying. I think what you're saying is that the privatization of healthcare in India, which I'm not really familiar with that, but I'm just taking you for your word, is contributing to a kind of corrupt practice of people performing sex determination tests and then sex-selective abortions. And what I would say is that may very well be true, but I have to say that in China, there isn't privatized healthcare, and they are still doing it because corruption can exist in public healthcare as well. The Chinese Communist Party runs healthcare in China, and also it is illegal in China to perform ultrasounds for the purpose of determining the sex in order to abort the baby based on the fact that she's a girl. So this is illegal in China and India, and it is practiced in both places, and there are corrupt doctors who are government doctors, and there are corrupt doctors who are private doctors. So I'm not sure that it's the privatization that is causing this.
Corruption.
It's corruption. It's basic greed that happens with any kind of a human being, whether they work for the government or they work for private industry.